solar that will be able to take that.
No, that's what we've done now. Just for instance, the NRA area in Gadua, when they were building that new laboratory by JICA, they had the solar panel extended. They had to remove them for them to finish their construction. So what we're doing now is trying to complete it. Put the solar back. And then so we did power audit for the two laboratories. So we know that we know what happened.
But many of the emergency situations in the country, though emergency, they are also predictable. Many of the emergency situations you spoke about, though emergency, but they are highly predictable. And that's why we need to work towards disease prevention and control. Even though they're emergency, but we know many of the emergency are something that we know that even with the situation in the country, we already know that it is not the issue, a matter of if, it is a matter of when. So I wanted to look into that critically and look at areas where you know that are easily exposed to some of these public health concerns. What national strategy has NCDC put in place, such as vector control or even research, to drive strategies for this disease prevention now and going forward?
These are based on science. And that's why again, when I came again, I did a restructure, created the Department of Disease Prevention and Health Promotion, and then amended the department, now created a Department of Research, Department of Research, Statistics and Planning. So research, yes, we're actually involved in research. But for what I meant again, which we are trying to amend and correct, that a lot of the research work have been sponsored by external people and partners. And at the end of the day, they take away this information for their own ends. You don't believe it when I started saying, give me a list of all the research work I've done in NCDC. It's amazing what came out. Okay, bring the documentation of the research for proposal now. Many of them were not found. That's why we're changing that again. We are currently research work now. And again, building local capacity, even with funding from partners. I will insist everything has to be done. So research work we're doing. We're probably working on Lassa fever vaccine. Okay, along the same line, we are doing Lassa fever control again, different factors. Take for instance now, on this Lassa fever thing, they say that rat, multi-mammal rat, is the only rat. But some research are showing now that other rats are getting involved. And this is where again now these viruses change characteristics. Even that one or two reports, although they need to be validated, that again other reptiles who are involved in this. So these are some research workers. We're doing research on cholera. We're doing research on many of these again, operational research again. What we do again. So that research is going on. But again, we have to cultivate that culture properly. Build local capacity rather than relying on external partners.
I hope we get to know the results of the research. I hope it's going to be published. The findings of.
No, they have to.
Yeah.
So, but we create our own, we publish our own papers, we create it that we can go and do that.
Because there is no need for any research if it's not been published.
For vector control, unfortunately, that's why I say it's a one health issue. For malaria, for instance, now, yellow fever, malaria, they're not under NCDC. There's an agency of government.
Yeah.
That's what. So, you understand me? For us, we can't do rodent control in the NCDC. That's why I say it's a one health issue. We have to work hand in hand with the Ministry of Environment, Ministry of Agriculture, you understand? For cholera, it's a disease apart from wash, sanitation, hygiene. It's a physical planning issue. And we don't physically plan our towns and cities. This is why we get all this going on. It messes up the environment, messes up flooding, all those issues. So these are things that's okay. That's why they call it one health issue. I can't provide toilet. It's not part of my remit. I can't provide water. But again, all of us must work together, and that's why planning is key.
Okay, from here, let me, due to high infectivity and case fatality rate, I said due to high infectivity and high case fatality rate, management of Lassa fever, even in hospital, is challenging. Recently, we have had a lot of fatality among health workers. What proactive measures are in place for healthcare workers to encourage health workers to be proactive in emergency situation like this? Do you have any engagement with health workers?
That same question was posed at me when I was at NCDC yesterday. That's the issue here. And let's go back to history. In medical school, we're taught basic infection prevention and control. Even if we don't have an isolation center, if you suspect that a case is infectious, you cordon off the place. And maintain strict barrier nursing until you can get that happen. So IPC, that's why again, she is the chief IPC. We are training people for IPC nationally up to the level of diploma that will deploy to different states. That's number one. Number two, I've lost track of virus. Healthcare once again, it's a personal thing. Now, one, you can look at it again, provision of these materials they need to work with, hand gloves, face masks, PPEs, whatever it is. Are they available in correct number? That is wrong. Again, you have individual personal issues. Some of them don't feel they don't need it until they started dying. That's when they started making us about. You understand? The training is that once you feel something is infectious, you protect yourself first.
Yeah.
And that's why, again, over this issue, we are called the NMA. We met them 2 or 3 days ago. We made joint statement how they can communicate and we started training them, how they can train. Again, they can train virtually. We have all the links there on our website.
In the annual conferences and
yeah. But it's a continuous thing because it's a behavioral change thing.
okay, so
there's a need for it. Especially now that we're engaging in some national engagement, not only states, and local. Yeah, but I think so I agree with you entirely, sir. All stakeholders.
And Chairman, this will open doors for healthcare coverage and ensure that the people of Nigerians are protected and their lives matters more than anybody. Thank you, Chairman.
Any areas of your enabling acts that you think you want to amend?
yeah, we have dealt with that, but many of those things we still want to. Those things are done before NCDC. So the ball is in your court. Yeah. It seems we are the one trying to help NCDC. NCDC does not even want to help herself. I still maintain that you are still very quiet. We need to hear NCDC every day. Whether I like it or not, I remember during Ebola, Ebola and COVID-19. Yeah. Even though we don't have that pandemic, but people are dying every day in different states. Having 10 outbreaks in a nation is not something that we should go and sleep. Things that are not as critical as the need to protect the health of Nigerians. The reason is that they are making noise and they are speaking about it always. Let's occupy the media space.
I agree with you.